So the next talk is an overview of allergy and asthma. Again, a very broad talk to give in 1 hour. So I'm really going to touch on some of the major features to review and go over some of the aspects that are most likely to show up on the boards. We've all gone through this table, and it's always important. There are 4 classical types of hypersensitivity reactions described. These are important because whenever you're evaluating patients with suspected problems, drug reactions, things like that, food reactions, we always have to think about what we think the underlying mechanism is. So type 1 reactions are IgE-mediated immediate hypersensitivity. So it's anaphylaxis. When you think of allergy, you eat peanut butter and you break out in hives, have problems breathing. Type 1 mediated. Type 2 are cytotoxic related to IgA or IgM. Hemolytic anemia is the best example. Type 3 are immune complex disorders. Serum sickness is the best example. Typically these occur well into the course of treatment, for example with antibiotics, where you have a large amount of antibody, a large amount of the antibiotic, and you form complexes that are able to deposit in the tissues. And it gives you very characteristic features. In type 4, delayed type hypersensitivity, like contact dermatitis. So all of these are important when you're evaluating patients with suspected allergy because it's not all type 1. The type 1 reactions, in what you typically see with allergy, there's 2 steps. One is sensitization. You don't develop allergy the first time you're exposed to something. The first time you're exposed to something, you become sensitized to it. What happens? You're exposed to the antigen. Your B cells produce IgE antibody to that specific antigen, whether it's tree pollens, whether it's foods, whether it's drugs or stinging insect venom. You produce that IgE. It becomes fixed on the surface of mast cells. And that's your sensitization step. You develop IgE, it binds to your mast cells in your tissues or your basophils in your bloodstream. Then you come along a week or 2 later and you're exposed to that same antigen. At this time you already have the IgE there. Your allergen binds that IgE on the surface of mast cells, it cross-links them and your mast cells become activated. And they release many products including histamine and other mediators, cytokines, chemokines, but this is the underlying basis for all allergic diseases, whether it's allergic rhinitis, food allergy, drug reactions. This is what we talk about with immediate type hypersensitivity reactions. There's also the early and late phase responses, which again comes back to what's going on with the cells when they're activated. Early responses are those responses that occur immediately after exposure to the allergen. It's usually due to release of things like histamine and other preformed mediators. Symptoms that you can get include sneezing, rhinorrhea, pruritus, bronchospasm, immediate onset after exposure. You can also develop late phase responses that can occur peak 6 to 8 hours later. These responses are a result of influx of inflammatory cells. So with the allergic reaction, histamine, leukotrienes, things like that give you those early phase responses. Late phase responses are things like chemokines that attract immune cells and you get inflammation in the tissues involved. So that can give you symptoms like chronic nasal congestion, chronic lower airway inflammation with edema. So that's the underlying basis for the immediate type hypersensitivity reactions. So real world, what are the environmental triggers that can trigger allergic diseases? And here we're talking about respiratory diseases, asthma, allergic rhinitis. And they fall in 2 categories, allergens and irritants. The allergens we break down into indoor and outdoor. Indoor, the most common are dust mites, animals, so pets, furred animals, or even rodents. Cockroaches, which are very common and associated with asthma, and molds. Outdoor include pollens, so trees and grasses which are out in the spring and summer, weeds which are out more in the late summer and fall. There are also outdoor molds that have some seasonality to them as well. And then you can never forget nonspecific irritants that also affect the airway. Things like tobacco smoke, air pollution, scents, cleaning agents, all can non-specifically irritate the airway and can be implicated in some of the reactions, particularly with asthma. So what is the role of allergy in asthma? Allergy is common in asthmatic children. 80 to 90% of school-age children with asthma have some component of allergy that's also playing a role. The presence of allergy is associated with more severe and persistent asthma. So those patients that have true allergen-driven asthma, it tends to be much more severe, particularly in the school-age years. Allergen exposures associated with an increased risk of developing asthma also increase asthma morbidity. It triggers it. Allergen avoidance can reduce bronchial reactivity and asthma morbidity. And the key here is allergen avoidance is rather difficult, and it's important to look at the individual child, identify what triggers are important for them, what they're sensitive to, and it's an all or nothing sort of a thing. So quick fixes like dust mite covers on the mattress alone don't do a whole lot. The interventions that are comprehensive, that include things like passive tobacco smoke and addressing all allergens, have been relatively successful, but it's difficult. The NHLBI guidelines, there are new guidelines that we're still awaiting. This is the last edition. So for patients with persistent asthma on daily medications, it's recommended that clinicians identify allergen exposures that may be playing a role. Use skin testing or in vitro RAS testing to test for specific sensitivities to those allergens. So what is this specific patient sensitive to? And implement environmental controls. So this really is sort of, it comes, every step in asthma control is important. The first and most important step in controlling allergen-induced asthma is to control exposures to those allergens important for that child. So this is a picture of a dust mite.